Vanakkam, good morning. In this video, we are going to discuss about the corpus luteum. Corpus luteum is the important short notes from the reproductive physiology. The corpus luteum occur in the luteal phase of the menstrual cycle. So, second half of the menstrual cycle is called as the luteal phase, from the ovulation to the next menstrual cycle. So in this diagram shows the different follicular stage in the different ovarian follicles within the cortex of the ovary. Primordial follicle, primary follicle, vesicular follicle, Graafian follicle, and release of the ovum during the ovulation. From the ovulation, luteal phase is starting, and corpus cameragicum, corpus luteum, and corpus albicans. Corpus luteum is the glandular yellow body. It is produced from the ruptured Graafian follicles. Ruptured Graafian follicle after the release of the ovum during the ovulation. So corpus luteum is derived from the ruptured Graafian follicle after release of the ovum. So immediately after release of the ovum, the blood is filled within the Graafian follicle, that is converted to the corpus cameragicum. Corpus cameragicum. The blood is then converted to the blood clots. Clot is then changed to the serous fluids. Blood is degenerate and converted to the serous fluid. It contains a large amount of the fibrin. The corpus cameragicum is transformed to the corpus luteum due to the luteinization with the help of luteinizing hormone. The luteinizing hormone also play the important role in the luteinization. So in the Graafian follicle, granulosa cells, Theca cells are there. Here the corpus luteum, the granulosa cells is converted to the granulosa lutein cells, and the Theca cells are converted to the Theca lutein cells. The granulosa lutein cells contains fine lipid granules and yellowish pigment granules, and the Theca lutein cells contains only the fine lipid granules. The yellow, so yellow pigment granules gives the yellowish color. Glandular yellow body is due to the presence of the yellow pigment granules. So corpus luteum contains the fine lipid granules and yellowish pigment granules. Both are present in the granulosa cells. Only lipid granules present in the Theca lutein cells. The corpus luteum having the Theca lutein cells and granulosa lutein cells. The corpus luteum is act as the endocrine glands. The granulosa lutein cells produce the more amount of the progesterone, and Theca lutein cells produce the estrogen. The progesterone is secreted more amount during the luteal phase of the menstrual cycles. So with the help of the luteinizing hormone, LH hormone is play the important role in the secretion of the progesterone from the corpus luteum. The main function is corpus luteum is act as the endocrine gland, secrete the progesterone from the granulosa lutein cells, estrogen from the Theca lutein cells. It is also important for the maintenance of pregnancy. The corpus luteum produces the more amount of the progesterone. It is helpful for the maintain the pregnancy until the 3 months, first trimester, until the development of the placenta. The ovum released from the Graafian follicle is not fertilized. The corpus luteum is called as the corpus luteum mensuralis. The corpus luteum increases the size. It produces the more amount of the progesterone. So if not fertilized, ovum is not fertilized, the corpus luteum is converted to the corpus albicans, that white scare. That is the transformation of the corpus luteum mensuralis to corpus albicans is called as the luteolysis. If the ovum is fertilized with the sperm, the corpus luteum is called as the corpus luteum graviditatis or corpus luteum in pregnancy. This corpus luteum increases the size. It produces a more amount of the progesterone. It maintains the pregnancy for the next 3 months until the placenta secrete the hormones support the pregnancy. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.